Hey everybody, welcome back to the Outcomes Rocket Founder Stories. So excited that you tuned in with us again. I've got the pleasure of hosting Bill Snyder on the podcast. He is the founder and CEO of Cylinder. They're a digital health innovator focused on improving GI care, and they're doing a massively great job at it. Bill's background includes not only digital health leadership, but he also previously spent over 10 years at Humana in various leadership positions. And I'm pumped to have him here on the podcast. Bill, welcome.
Saul, thanks so much for having me, buddy. Great to be on.
It's so great to be on. I've got tremendous amount of respect for you, Bill. Your career is impressive, both on the payer side, but also now as an entrepreneur. And to kick things off, we're going to spend time talking about Cylinder, but I want to start off with you, man. Like, tell us about what inspired you to get into healthcare, but more importantly, get into entrepreneurship.
Yeah, so the healthcare story, I was an economics major in undergrad, and I'd spent 4 years studying economics and understanding supply and demand, and everything that econ teaches you. And then I took a health economics course my senior year, and it was basically like, hey, forget a lot of what you learned, because here you have asymmetric information, you have a different purchasing mentality. And so it was really interesting to me. And so a lot of it was about why healthcare is broken. And so that was kind of my light bulb moment where I was like, I know I want to be involved in healthcare. And I was fortunate to join a leadership rotational program with Humana. As you mentioned, I spent over a decade there, great organization, and learned a ton about healthcare and the business of healthcare, and really seeing every aspect of the healthcare ecosystem. So moved all over the country with Humana, and ultimately managed the Chicago office for Humana, and really loved it, learned a lot. It's a great organization with great people, but I found myself on the weekends and evenings doing entrepreneurial things. And so I actually worked with a student from Northwestern, and we built a patient to provider app. And so we did that again, spent Sundays, Tuesdays, and Thursday evenings working on that. And never ended up bringing that to market, but that was my first foray of, hey, this is really what I want to do, is build organizations that can ultimately impact the care being delivered to members. So that was kind of the beginning stages for me of this great journey, and it's been amazing throughout.
Hey, that's really cool, Bill. And folks, just so you know, like Bill and I know each other from Chicago, the healthcare scene there. But I never knew about your app, man. And just kind of a message to everybody out there: don't be afraid of trying it. And a lot of entrepreneurs start with a side hustle. It doesn't work out, and maybe that side hustle turns into something serious. And Bill is an example of that. So on that transition, right, your app didn't work, but now you're at Cylinder, and you guys are running on all cylinders.
That's right. Our mission is to revolutionize digital health gut first. So we're working with individuals who suffer from chronic GI conditions and their related symptoms. So that's things like ulcerative colitis, Crohn's disease, irritable bowel syndrome, GERD, but it's also all of these individuals who are out there that are symptomatic, that are having some type of GI distress, like bloating or cramping or heartburn, and they don't really know what's going on. And either they can't get in to see a provider, or maybe they've seen a provider but don't have a formal diagnosis, or maybe they're embarrassed to talk about what's going on. So they just haven't taken that first step. And so it's a really big population that we're solving. It's a really big problem that we're tackling. And it's been absolutely incredible to build this and work with such talented people.
Bill, and so thank you for that. Yeah, it's an interesting platform. Tell us how it works. How do you make this easy for the member or the patient? Talk to us about how the whole thing works.
Yeah, absolutely. So we find our members through partners. So we work through employers as a covered benefit and health plans as a covered benefit and part of the care that they're delivering. And so for the member experience, I think the most important thing is it's an all-comers approach. So I mentioned working with those individuals that don't have a formal diagnosis today. And that's really important because those are individuals who end up in the emergency room. They often are having repetitive tests done. They're going to see different types of providers to try and understand what's going on or what's wrong. And so for us, that's key. And so because we're working with such a variety of patients, What's really important is that you build a scalable digital platform like we've done. And so it starts with the patient intake. So we understand the personal needs of each patient. We understand their condition and or symptom. And then we build evidence-based clinical pathways based upon their personal needs. And so that kind of hyper-personalization is key to our success because these conditions are very different. They're nebulous in nature. And so each patient has a very tailored experience. And then we wrap that with a coordinated care team. And that's made up of health coaches, registered dietitians, gastroenterologists, and internal medicine specialists. And so we're delivering these evidence-based care plans. We're wrapping with a coordinated care team. And then we're pulling in external parties and labs as well. So we're doing things like colorectal cancer screenings. We have a national relationship with Exact Biosciences, so we can send Cologuard kits to the home. We're
Cool.
providing digital therapeutics like cognitive behavioral therapy for patients who suffer from IBS. So it's all supposed to be care in their pocket at their fingertips that gives them the care that they need when they need it most.
That's awesome. It's end to end for the GI experience before it actually gets exacerbated.
That's exactly right. And then the key for us is we've built our solution to fit within the care ecosystem. So it's really important that we're not creating a silo. Instead, we're working with providers in brick and mortar settings. We're identifying patients that should be going into the doctor's office and having tests done like a colonoscopy, and maybe they're avoiding it. We're saying, no, you really do need to get into the doctor soon. So it's really important that we say we're facilitating that care. We're not here to replace providers. We're here to work with them and support the members in between their visits and for all this care that's delivered much better via telemedicine platform.
Hey, that's really interesting. And Bill, I'm really curious about the missed cases, right? And so you talked about intake. How much of the platform ingests medical records and things like that prompt you guys to reach out and suggest you should be doing this?
Yeah, so we're able to intake a lot of information. Sometimes it's a little bit difficult to get it. That's the ongoing challenge of healthcare is that interoperability and who will share what information when.
Right.
And so I think the good news is we've gotten really good at working with just the patient to identify some of the core issues and do that really, really quickly. But at the same time, we're always looking to work with third parties to say, how do we build up that robust patient profile and continue to learn about the patient in an ongoing manner, and then also provide that information back to brick and mortar providers or other digital solutions as well.
That's awesome. Thanks for sharing that. Yeah, and it's just a reminder, folks, like you could own a pathway and not have to build it all. Like Bill's a great example of partnerships like the Exact Sciences partnership and others to really, cross the T's and dot the I's with a team of people that have done it well. So as you built this, Bill, what's something that's really kind of risen to the top as you guys have this and it's truly differentiated?
Yeah, I'd say a few things that we've done quickly that have helped us really grow as the leader in this space. The first is outcomes at scale, right? I mean, it's taking exceptional care of our members. And so that's been validated through our patient-reported outcomes where they say, hey, 92% of the individuals that are surveyed say thanks to our work at Cylinder, their digestive symptoms are reduced. 88% of those surveyed have said thanks to our work with our registered dietitians, we've been able to identify a trigger food that's causing inflammation, remove that from their diet. We've shown great financial outcomes as well, 3-to-1 ROI. So we're reducing emergency room visits. We're reducing duplicative doctor visits. We're improving medication adherence for our patients. So starts with the member outcomes and the clinical outcomes, and then the fast follow is the financial outcomes that we can show to our partners. And so I think that's been really important as kind of the primary is the outcomes at scale. Second has been our ability to integrate with the care ecosystem, working with providers, but also working with other digital health solutions. And to your point, saying, hey, we've identified maybe that this patient would benefit from working with a solution for patients suffering from type 2 diabetes. Let's do a referral to this other solution because we think that they could really help the patient's care. And then the third thing is just continued innovation. It's never standing still. It's always looking at what can we do next to improve the care we deliver to our patients.
That's awesome, Bill. Really appreciate that. And look, building companies, building solutions, especially in healthcare, is not easy. I love what you've been able to do with this company. If you were to look back the last few years and just kind of maybe think of one of the setbacks that you had that was tough, but it made you better, what would you highlight?
Oh boy, there's a lot. As you know, so like anytime you're building a company, there's a bunch of roadblocks that you run into. I think the key learning for me as you go through ups and downs, building an organization and run into roadblocks. I always tell people two things: like find a mission that you're passionate about. If it's something that speaks to you, it's much easier to push through those down moments and those roadblocks when you've got that kind of passionate view of, I know this is a problem, I see it impact my loved ones or me personally, and I want to solve it. So I think that's one thing. And then the second thing is just building a world-class team, just getting people that are also passionate about the mission, and are dedicated to what you're doing and building every day, and that you can enjoy working with and being around, I think is essential. So I'd say those are the two things that I talk about when I think about like what's gotten me through some of the barriers and the difficult times, because there's always going to be challenges and there's always going to be hills to climb. And so making sure that you've got that mission and you've got that great team, I think makes it a lot easier.
Yeah, no, well said, Bill. We're only as great as the team that surrounds us. So I love that, and having that North Star is key. What about the area of product market fit? There's a lot of companies out there still trying to figure it out. What advice would you give to them?
Yeah, a big thing for me is ask a lot of questions. I think sometimes people come in and they assume that they understand the patient need, they understand the market dynamics, and that's always shifting, that's always changing, and you can always learn from those conversations. So it's getting in contact with either your members or your prospective members and understanding what it is they're looking for, what are their pain points that you're trying to solve, and then the same thing with the partners. I think the other thing that's unique about healthcare is you sometimes see people with a great product or a great idea come to market, but they don't understand the healthcare ecosystem. They don't understand the importance of the relationships with payers and other providers and employers. And so I think that understanding is really key to be able to ultimately reach the numbers that you want to serve.
That's great, Bill. And how much of your success would you attribute to your 10 years at Humana and the experience as a payer wearing that hat?
That definitely was super helpful for me. I mean, just that understanding of provider contracting, of how health plans think and make decisions, how they evaluate new and innovative technology, was extremely helpful. But again, I always take that kind of view of a consummate student, right? You're always learning, you're always developing. So that helped me a lot. But healthcare changes all the time, so I'm always learning every day. But I think staying up to date on that and being in the conversations and thinking outside of kind of your domain, right? So really understanding what are the more kind of market leading headwinds or tailwinds that are influencing healthcare in general, is something that's always important for any leader in the healthcare space to be keeping a pulse on.
Oh, that's gold. Folks, take advantage of this. I would hit rewind on that. Listen to it again because Bill's dropping some major value bombs here. Take advantage of them. Hey, let's shift back to Cylinder for a bit, talking about the business and sort of the value prop. Talk to me about when one of your customers really sees the value, like the aha moment. What does that typically look or sound like?
Yeah, it's a good question. And so, a lot of times you go in thinking it's going to be when we show them these massive savings that we're able to deliver to them. But the reality is it's the patient voices. It's when, we've got stories of CEOs of our companies, big companies that we work with, getting a letter from a patient who's working with Cylinder, who says, "Hey, this solution changed my life." And we get that all the time. We get patient stories where they say, "I've been on this odyssey, this journey to figure out what's going on. I've been scoped multiple times. I've seen different doctors, different specialists." I mean, decade-long journeys where they're like, no one's been able to help. And they work with us, and after a quarter of a year, they say, "Hey, my symptoms are reduced. I finally feel in control of my digestive health. My anxiety is greatly decreased. I'm just feeling great. And they gave me my life back." And I'd
Wow.
say those are the moments where it's like, I mean, we get those stories, and that's always so impactful for our partners and our clients. And we certainly see that.
That's huge, man. It's why we're in this business to begin with, and being able to make that difference is just it's amazing.
Absolutely. You said it.
That's cool, brother. That's cool. Really appreciate that. For everybody listening, you guys work with, just for the sake of ultimate clarity, you guys work with payers and providers. Tell us about who you serve.
Yeah, absolutely. So we started in the employer market. So large self-funded organizations were our primary partners. We're working with great organizations across the country. We've got members in every state. We're available to provide care in all 50 states. And so working with a lot of large national organizations. And then we also work with major health plans. So we're able to bill as a claim through these health plans. We're able to sign on their paper. So it makes it really seamless. If you're a big employer, and you want to engage with us, you can do it through your health plan. And then we're also working with a bunch of the aggregators as well. So some of the digital hubs. And it's been incredible. The growth has been amazing. And again, I think it just further validates the need that we're serving. And the enrollment has been terrific. Even when we're working with a given employer, we see incredible enrollment rates. And so that's further validation to those employer partners that, this was a significant need for their patient population.
Very cool. I love that. Well, thanks for clarifying that. For everybody listening, take advantage of this opportunity to learn a little bit more about what Cylinder has to offer, whether it's for your organization or for the members that you take care of. Now's the time. Take advantage. These indications are everywhere. They're easily missed, but not with Cylinder. Bill, what closing thought would you leave everybody listening today with?
So I think for me, like in terms of what we're building at Cylinder, we look at how important it is to wake up every day thinking about the members that we serve. And we're talking about GI health, but the reality is digestive health is connected to everything. So when we think about the patient population that we're ultimately serving, sometimes we joke a little bit that it's anybody who eats. We've all been through GI distress. And there's different levels of acuity, but we're serving the entire population. And so I think that that's really important and foundational to the work that we're doing. So I'd ask anybody listening, definitely come take a look, check us out. And then in terms of just any of the founders out there, you said it best all. It's like, hey, take the risk, take the leap. If you're thinking about it, it's been the most rewarding experience of my life to build something. And so I would recommend to anybody, take a page out of Saul's book or any other founder, that this is it's an incredible opportunity to build something that you're passionate about.
That's awesome, Bill. Love that closing message. I appreciate you so much for jumping on with us. And folks, make sure you check out the show notes on today's episode, where you will find ways to get in touch with Cylinder. What's the website, Bill? Is it cylinder.com?
It's www.cylinderhealth.com.
cylinderhealth.com. So check them out. We'll include it in the show notes. We'll include Bill's LinkedIn profile there for interactions. Folks, now's the time. Take advantage of this, and I appreciate everybody tuning in. Stay tuned for the next episode. But for now, Bill, I want to thank you so much for joining us.
Thanks for having me on, Saul. It was great.